Students, I am Dr. J.P. Das, Director of Moshumi Hospital and Principal of National Institute of Medical Science. Today, we have brought a very important topic, that is dysmenorrhea. I hope you will go through the full video and you will learn about the very common disease, that is dysmenorrhea. First of all, what is the definition of dysmenorrhea? Dysmenorrhea, here definition is given. Dysmenorrhea is a painful menstruation. The pain usually occurring just before and during the flow, but it may also be present after flow is ceased. It does means that is painful menstruation. When there is menstruation, there is pain. Pain may be at the time of menstruation, maybe little before menstruation, maybe after the menstruation. There are some varieties of menstruation. What are the varieties? Number one, spasmodic or primary dysmenorrhea. Number two, congestive or secondary menstruation. Spasmodic or primary menstruation, it means when the dysmenorrhea, that is pain, starts from the very onset of the menstruation, the day from which the menstruation starts, from that day when the pain starts, that is primary menstruation. It may be in the year of 13, 14, 15. But secondary menstruation, secondary dysmenorrhea is this. Previously it was okay, there was no pain, but after that she had some disease or for any problem, the pain starts. That is the secondary menstruation. Then another variety, that is membranous menstruation. In this variety, pain is there, but with the bleeding, small pieces from the uterus comes out. The pieces maybe small tubes, maybe it's pear-shaped, maybe a sac, maybe tube-shaped, anything may come. If it comes with the blood, then we should call it membranous menstruation. It may come from the lining of the uterus. Another variety is there. It is called neuralgic dysmenorrhea. It is a variety of the spasmodic menstruation. In this class, there is no structural lesion or organic disorder. The dysmenorrhea depends on the patient's psychological condition, that is neurotic. The uterine nerves and there is something problem in the general systems when the pain starts. Sometimes the patient has a very, very sensitive uterus, that is like the morbid sensitivity. Then when she has psychological problem, then this pain starts. It produces neuralgia. It may be in the head also, in the stomach also. So it is neuralgic dysmenorrhea. Now come to the obstructive menstruation. It is actually a variety of spasmodic dysmenorrhea. In this class of dysmenorrhea, it depends on the partial or complete closure or obstruction of the genital tract. If there is there is small opening in the hymen or it is closed, there will be dysmenorrhea. And next is congestive dysmenorrhea. in congestive dysmenorrhea, normal congestion increases behind psychological limit. Uh, Behind physiological limit, where too much congestion, the woman cannot tolerate it. In that case, there is dysmenorrhea. This condition is called congestive dysmenorrhea. Here is a picture. Here you see the where menstruation occurs. Menstruation occurs in this area around the genitalia, in backside also around the sacrum and above anus. There is area. In this picture you can understand very clearly where there is dysmenorrhea. Now, the causes of dysmenorrhea. The causes of dysmenorrhea is unknown, but there are some factors which are associated with this. What are those factors? First, come to the primary or spasmodic dysmenorrhea. So, again come to the definition. It signifies the pain due to menstruation only and of the uterine only. It will start from the uterus. There may be pinhole os. The os may be so small, it is pinhole os. There may be conical cervix. The cervix may be conical. It is triangular shaped. And there may be malformation in the cervix, like some people who do not have 5 fingers, 4 fingers only. Some girls have cleft palate. It is like this. Malformation of the, it may be like rudimentary horn. Bicoronate menstruation is, uterus is divided into 2 parts, and separate uterus. 2 separate uterus may be there. These are the congenital abnormalities for which there may be dysmenorrhea. There may be ischemic condition. What is ischemic condition? When there is lack of blood supply in the uterine wall, that is called ischemia. When there is lack of blood supply in the heart, it is called heart ischemia, then pain in the heart. When there is like this, when there is lack of blood supply in the uterine wall, there will be pain. It is uterine ischemia. Low pain syndrome. I have seen in the operation theatre, surgeon is cutting the leg of a person. Surgeon is afraid the person may die. But the person is saying, no sir, don't be worried. You cut my leg, I shall not die. There is such type of man. Another type of man is there. People are there. When we give a simple injection, 4 or 5 people has to grab him, hold him, so that we can put an injection. He feels so much pain, scratches. This is called low pain threshold. Pain is less, but you scream like anything. And somewhere pain is much high, but you say, no, okay, we shall tolerate. Lots of this time, when you do practice, this type of thing you will get. So there may be pain is less, but she will cry. I have lots of pain. He has to be as hospitalized. I had such type of our classmate who has to, for each and every menstruation, she has to be hospitalized. This is called low pain threshold. There is psychological factors. When there is a problem in her house, with problem with the husband, money problem, divorce, this may cause dysmenorrhea. There is a hyperplasia factor. See the muscle of the uterus. If the muscle of uterus becomes too much big, there may be problem. There may be dysmenorrhea. Neurogenic problem, I said, when there is too much pressure over the nerves, she will feel pain. And small pains, she will be so scream like anything. There is morbid sensitivity. Sensitivity is too high, so she will scream. Sometimes hymen is really narrow, so narrow the blood cannot pass. So accumulation of blood in the uterus, so she will scream. There will be congestion, contraction. The uterus will contract and try to push the blood out, but blood cannot come, so there will be pain. Retroverted uterus. Generally, uterus remain in this way, like this. When the uterus would be like this is called retroverted. Uterus remain bending on the front side. That is in the frontal side. This side will be in the frontal side. But when we bend in the back side, that is called retroverted uterus. In that case also, there may be painful menstruation. Now, come to the secondary congestive dysmenorrhea. What I told earlier, primary is from the very onset when there is pain. That is primary. But when it was okay, first it was okay. 2 years, 3 years, 5 years, 10 years, it was okay. But after that it started. Then we call it secondary. The cause of secondary dysmenorrhea is the chronic pelvic inflammation. If there is salpingitis, that is inflammation in the fallopian tube, maybe in other organs, then it is called chronic pelvic inflammation. And there may be endometriosis. What is endometriosis? Endometriosis, when the endometrium tissue grows in other part of the uterus, then there may be dysmenorrhea. What is the function of endometrium tissue? It is a menstruating tissue. So there will be bleeding. It has the property of menstruation, bleeding property. When it will grow in other part, say outer side of the uterus, then bleeding would be there. So when there will be bleeding in other part rather than normal part, it will create problem. There will be pain. There is a kind of tumor which occurs in the wall of the uterus, which is called uterine fibroid. From there also, there may be dysmenorrhea. Now, we are doing a comparative study. What occurs in primary dysmenorrhea and secondary congestive dysmenorrhea. What is the age? First come to the age. Age for primary, it would be 18 to 25. In the secondary, she would be elderly lady because her menstruation previously it was okay. So she would be little aged person, maybe 30 plus. Now, what would be the type of pain? Type of pain may occur from the menarche, the day menstruation starts. From that day it may start. It may continue to 2 to 4 hours, years. And what about secondary? In secondary dysmenorrhea, it occurs after a painless menstrual period. 3-4 years, there will be no pain. After that, it will start. Now, the pain when begins? Generally begins 1 to 2 after the onset of the menses in primary cases and continue up to 2 to 24 hours. then gradually comes less. But in the secondary, it starts 3 to 5 days before the menstruation, and after which the pain gets less. What would be the nature of pain? Gradually, it is become colic, cramps, which will be very much painful, and full there will be in the case of secondary, there will be etching in the back also. During this menstruation, the pain, when there will be no menstruation, in primary cases, there will be no pain. But in secondary, when there is no menstruation, then also there may be pain. Now come to the associated symptoms. Associated symptom with the pain, there may be vomiting also. When there will be irritation in the uterus, there would be a tendency of vomiting always. So there may be vomiting, and in case of secondary, there may be menorrhagia, long time menstruation with discharge, and there may be infertility. What is infertility? She may not be able to give birth of a baby. Now some points you have to remember. What are those points? That is health of the person. In primary dysmenorrhea, health generally remains poor and should be anxious in mind. In secondary dysmenorrhea, she may be healthy. If you examine the patient per abdomen, what you will get? You will get nothing abdominal, everything is okay. But in secondary dysmenorrhea, you may get some pathology, maybe tumor, maybe other pathology. Per vaginal examination, if you do, what you will get? In primary dysmenorrhea, it would be normal. But in secondary dysmenorrhea, there will be some pathology, like tumors, fallopian tube inflammation, or anything else. Or now, the prognosis. What's the fate? In primary dysmenorrhea, it goes away. After 3-4 years, it will go away. When she will be married and give childbirth, it will be okay. But in secondary menstruation, there is no such characteristic. You have to treat the condition for which she is having pain, that is tumor, fallopian tube inflammation, like this. Now the management. What you will do when such type of patient will come to you? First, you have to give an education to the girls that menstruation is not a abdominal something, and pain with the menstruation is not a very difficult thing. It is not going to harm you. You have to pacify the girl, then she will be satisfied. And at the time when there will be pain, give her 1-2 tablet of paracetamol. Take her. 1 to keep in your house 1-2 paracetamol tablet. If there is pain, you take it. After a few days, it will go away. This is proper sex education you have to give. What is menstruation, how it occurs, how this pain occurs, all this. Symptomatic treatment, neither painkiller you may give. She should get adequate rest and encourage her daily to do work. Do work, no need of staying in the bed. And general health should be improved. A heavy person can lift a heavy weight. A healthy girl can bear the heavy pain. But a sick girl cannot bear a small pain also. So she should be healthy. And exercise. You tell her to do exercise. And psychologically she should be strengthened. Give her proper hope that it will go out. In secondary and congestive time, same as primary, but sometimes operation may be needed. In cases where dysmenorrhea is not going out, it is uterine, and when there is medical treatment fails, we can do DNC. DNC is dilatation and curatives. It may be advisable. But in teenager girl, you cannot do it. So friends, we have come at the end of this video. I hope you have liked the video. If you have liked, please give a like. If you are new in this channel, please subscribe this and push the bell button such that I can bring such new classes to you, and you will learn lots of things from this. Thank you very much for watching this. Hope we shall see you in the next Sunday. Until then, bye bye.